Well, this Black History Month, we are looking at disparities in prostate cancer outcomes for black men.
We have urologist Dr. Arthur L. Burnett joining us, the second joining us to talk all about it. Good morning, doctor.
Good morning.
Yes, so this is a very important topic. Talk to us about the importance of making sure people are aware of this.
Well, prostate cancer is an important a disease state that occurs in black men. So it's pertinent to talk about this during this month, Black History Month. And the messaging I'd like to share, I think, is one in which men should be attentive to this problem.
Yeah. Now, we talk about it being a problem all year round. This month, of course, we're focusing, but the stigmas can't seem to get past sometimes the stigmas just to get folks to come in and have that conversation with you. How do you get past it? How do you get folks to just say, hey, let's talk?
Well, how we get past it, I think, is to try and keep everything in a very positive tone. Your health is important. Important to take charge of your life and to thrive and be there for your family, and it all begins with your best health.
Right.
So everything in a very upbeat, positive tone, and get past the stigma, get past the shame or the embarrassment surrounding prostate cancer and aspects of it having to do with the men's health function and that part of the body.
Right.
We need to get past all that.
Okay.
Yeah.
And from studies in your experience, why are black men in particularly more likely to be diagnosed with prostate cancer?
Yeah, that is kind of a perplexing thing. We do know statistics. We do know that black men have about a 60% higher rate of acquiring prostate cancer. And really what's most disturbing is about a 2.5-fold higher mortality rate from prostate cancer, dying from prostate cancer. So this is a cancer that affects all men. It's the leading cancer in America, but disproportionately affects black men just in terms of incidence and its impact.
And disheartening, especially because this is a treatable cancer. If caught early, it's not one that has to be a sentence.
Well, yeah, like many conditions. Anything you can identify earlier, the better. All too often, it's diagnosed late. And part of the challenge with the prostate cancer is that it is not always associated with early symptoms. So getting tested is what's key here. And that's why we do talk about screening. We talk about programming like this to make sure that individuals are aware of it, and then go out and see your doctor and talk about how you can get at least assessed, particularly if you're in high-risk group, which black men are.
Mm-hmm.
Okay.
And on that note, when is that right age for men to go get screened or tested, and what does that test look like? What should they be asking?
Sure. So let's talk about that. Certainly, men, be proactive. Talk with your primary care doctor. Doesn't necessarily mean your first doctor needs to be a surgeon or urologist like myself. But at least go in, get a test. The blood test called a PSA, a blood test, is what we screen for. And so, and when should men get that? Well, yeah, the guidelines are somewhat confusing, but black men probably at age 40 should at least go in and start to have that conversation and get a blood test. And if that PSA blood test is outside the normal range, that should prompt then further evaluation with the urologist.
Okay. Now, men can be stubborn. May not hear this message the first time. So how can folks maybe who are in the life of someone who they think needs to get checked out maybe help them along?
Well, you make a very important point. We all know that not always are the men in the family driving best health care. Their partners, or their wives, or their sisters and daughters and all that sort of thing. But messaging here today is that everybody needs to hear about this, and certainly encourage your men, for those who are not men, encourage your men to go ahead and get tested and get evaluated.
All right. Dr. Arthur Burnett II, you are at Johns Hopkins. If folks want to find you, find Dr. Burnett at Johns Hopkins Hospital. Thank you so much.
Thank you for having me.
Appreciate your message.
Absolutely.
We'll be right back after a quick break.